Welcome back to Studio Chatter. It's probably safe to say that most families have been affected by breast cancer. To give us more details about that, let's welcome Kristen Wright from the Canyon View Medical Group to the table. Welcome.
Thank you, Kristen. I'm so happy to be here. Thank you for the opportunity.
Thank you. Tell us a little bit about yourself.
Well, you know, Spanish Fork has been a huge part of this community for so many years, and you guys have been here to warn, inform, and warm our hearts. So thank you for all of your work to you and your team.
You're so kind.
It's wonderful to have this.
Thank you.
So it seems that you have a special interest in breast cancer. Tell us more about that.
I do. So I'm working on my doctoral program currently, and talked to Spanish Fork's own Susan Chapman, Susan Chapman,
yes.
Who is our public health specialist in this area. And we were talking about some of the needs of a Spanish Fork community, and that includes things like socioeconomic status, physical health, mental health care needs. And a few years ago, she did this assessment and recognized that there was a huge emotional and mental health need in the community. So I think she helped train approximately 2,000 healthcare workers or community workers to kind of assess and fit that need. So we were talking about where we're at now and some things that we need to do now to help improve our community. And she shared some really stunning, kind of astonishing statistics with me about cancer. And I'm talking about the main cancers, so breast, prostate, and colorectal cancer. And those cancers, if you are diagnosed with one of those cancers and live in this local area, so I'm talking Springville and Spanish Fork and Payson, your chance of dying is quite a bit higher than the average in the state.
Why
and that
is
was
that?
Startling to me. I mean, who knew that your zip code would have that much of effect on your survival
Is it
rate?
the wind?
There is wind in Spanish Fork, you're right. Well, I don't know that I have an answer for it as far as where it's coming from, but I do have a solution to help make a difference. And so that means for women of the appropriate age, please get your mammograms.
And what is the appropriate age?
That is actually a good question, and I will tell you in just a second. Because there's really helpful information to know about mammograms. Mammograms are actually a highly effective way of screening for breast cancer. We find suspicious lesions maybe 2 to 3 years before you can actually feel a lump. So early detection is key to treatment. When we can get early detection and good treatment started right away, then we make a big difference as far as outcomes, and the cost is less. And I'm not talking just financial, I'm talking the emotional cost, as you can imagine too. So the appropriate age is a little bit of a question simply because there's some professional recommendations that are different from other areas. So the American College of Gynecologists and Obstetricians recommends doing a mammogram at age 40. American Cancer Society says 45. And the United States Preventive Services Task Force says age 50. So you can see why women are like...
Interesting. Which the Cancer Association, I would think that theirs would be the youngest, right?
Me too. Yeah, I
right? And our government, that doesn't surprise me, 70.
Well, 35 hasn't ever been a standard, but for certain women of risk, then that sometimes is an issue. So the big thing that tells me is that even in the medical field, we're not totally on board with what's the most important thing, looking at some of the anxieties that are created when we do mammograms too. I think most of us can recognize that. So what it means is you need to talk to your healthcare provider about what your risks are so that you know when you should start doing screening and then how often to do the screening. And it's really important, again, as I talked about early detection, it's because the survival rate when you're diagnosed with breast cancer, if it's still in the breast tissue, the 5-year survival rate is 99%. It's really high. If we wait until it moves to a little bit further out of the breast region, then the survival rate is still 86%, very high. And if it's metastasized to other areas of the body, that's more of a concern. So the numbers go down. But my point is mammograms are important, so you should talk to your provider about what's your risk and deciding when's the important time to get that done. So.
I think that people are, I know that breast cancer has run in my family. My aunt passed away from it, my mother had it.
It's a real thing.
But because of my aunt, my mom went in immediately and she found a little unusual cells, and so she decided for a double mastectomy. She knew the route. Her sister had gotten it, went into remission, got it back, and then ended up passing from it. So just took like at leaps and bounds. So at like age 28 to 30 is when we started as sisters getting mammograms, just because of the risk. I don't even know if that's like a good thing to do, but that's what we thought.
what you did that was so good is that you talked about your risk. And so sometimes it is true that we want to start doing mammograms screenings earlier. And an important thing that I think is helpful for women who have never had a mammogram before, if they go in for their first one, if they get a call back saying, we need to have you come back and get some more testing done, don't panic. That's how we are, right? As women, we go to these crazy areas.
Especially your first time. I was called
Yes.
back my first time because they're
Yes.
like, this is our first screening. Let's have you back.
Yes.
And my sister didn't go, my youngest one, because she was afraid of the results. So it took us almost 5 years longer to get her in.
Oh,
That is
wow.
actually a very good point. And recognizing that we're all a little bit different is an important thing, again, to talk about with your provider. Another thing that I think is helpful, if you've gone in for a mammogram or it's your first one or you had a bad experience, I think it's really helpful to tell the mammographer,
Right.
like, this really makes me nervous. If you communicate with them, I've talked to most of them on an individual level. They really are passionate about this. They really care about trying to make this experience as painless as possible. So when you can communicate that, that does make a big difference.
Do you think it's like the revealing aspect, like the nakedness part per se of it and having that? Or is it more the results? What is the thing that scares people the most about
That's
it?
actually a great question because I've done a lot of research of the scientific literature, and also Intermountain has done a focus group on what are the common barriers? Why do women not
Yes.
get a mammogram? And there's some common themes that have come up, and one of them is that I'm scared. I'm scared of what the results might be, or I'm anxious about the test. It might be painful, or those kinds of things. And so sometimes we think in our head, if we don't know it's there, it doesn't exist.
Yeah.
Flawed thinking, right?
Right.
You know, we've all been in the situation, if you have kids, when they're in the other room playing and giggling and talking or even screaming, you kind of know what's going on in the other room, right? It's when they're silent that you go, what is that? Is there a problem, right? And breast cancer acts similarly, that at first it's not painful. You don't feel a lump. And so you can't fight a war if you don't know that there's a battle somewhere going on in the periphery. So fear or anxiety, those are very common things. Sometimes it's time. As moms, we're busy. There's lots to do. But the truth is, it doesn't matter how rich, how famous, how popular, how old, how smart you are, we can't create more time.
Right.
So that's another thing. Sometimes it's access to care or lack of insurance, those kinds of things. But there are programs out there to help women with that.
I think it's the unknown, right? It's all those
Yeah.
together. Like, I
Yeah.
don't have enough time, but I'm not really at risk, and I don't really want to pay for it, so I'll just put it off for another
But
year.
insurance pays
They
for it
do.
now.
They do.
Preventative,
And if you
totally.
don't have insurance, Utah County Health Department does have money. The state has set aside money and resources for things like that too. One thing that you said that was really important, genetic factors really play a role, and that is something worth talking about all in of itself. But I do hear women say, well, you know, it's not my family. I'm probably okay.
Oh, wow. Flawed thinking again.
Flawed thinking again, because 80% of women who are diagnosed with breast cancer, it's not in their family. So there are lots of reasons, and I think just being aware of that is very beneficial.
So, Kristen, with it being October is Breast Cancer Awareness Month, and you're at Canyon View Medical, will you tell us like what you're doing there, like what's your role there, and then what is Canyon View
What are we doing to
this
help
month
promote this?
Yeah.
Well, so I'm a nurse practitioner at Canyon View Medical. I work in women's health, that specialty area. We also have family medicine providers who are exceptional at taking care of women and families to make sure that they're up to date on their routine screenings. We also have pediatrics, which doesn't apply to this, but sports medicine also. So we try to fit all of those needs that the community has. And at Canyon View, we've really looked at our processes to say, are we screening everyone that's coming through the doors for an appointment? And we've found some ways that we can actually work a little bit harder and a little bit better. So we're trying to ask people, are you up to date on all of your routine screening? And urgent care is a different thing. Their focus is going to be a little bit different. Our care coordinators, the ones who coordinate with facilities, they're working on communicating and getting appointments quicker because that has been a delay that we've seen. We're also working on integrating a texting system so it's a little bit easier to communicate with patients and facilities. And a huge thing that I think that you're aware of, but if you're not, I'm going to tell you, Revere Health and Mountain View Hospital are just down the road, and Spanish Fork Hospital has been exceptional at getting people in to get their routine mammograms. So we're doing everything we can in this community to help people be aware of the issue and then get the screening. So it's really helpful that way.
On that point, Spanish Fork is relatively a pretty healthy community. So what's the factor there?
I am so glad you brought that up. It's been surprising that we die of cancer more often. So that's been kind of one of the big triggers. And as we talk about Spanish Fork as being a healthy place, sadly, even Utah is a pretty healthy place when you look at the whole area. Sadly, Utah, our mammography screening rate is one of the lowest in the entire nation. Our state is at the third to the lowest right now. Which is 7% lower than the entire state. We have a little bit less incidence of breast cancer, but still women in our community are dying from this. So we
the word
can
needs
do
to get
better.
out.
Yeah.
We need to
can
do better. Yeah, we do.
That's very important.
I got my last mammogram there at the Spanish Fork Hospital, and so slick.
Yeah.
You call down there, it's just easy. They fit you in. They're so kind, so dear. I mean, I think I was in and out of there in 15 minutes the one day. It was like I went back, got dressed, and she was all ready for me. And I was like, oh, wow, let's do it.
I just did mine last week.
And they give you the
had
me too.
Whoa, we knew we were going to be held accountable. We're like, woo!
I love it. Thank you for that.
I have not got mine yet this year, but I'm doing January. So we'll do it then.
Well, and that's important to make sure that you do it at the right time. Now, of course, if there's a problem, you don't wait that year to get it. You start looking at things in a different light, but that's really important. And as people try to decide, you know, like, why am I not getting a mammogram? I tell them, write it down. Like, purposely write down and think about why are you not going in. And as you start to collect information, sometimes Google is helpful. It's really helpful to have people who are proactive in their health care, but look for sources of information. Testimonials are great because it appeals to our human nature, but if you think that denial or just blind faith and megadoses of vitamin C is going to cure breast cancer or treat it, it's really not a proven way. So looking for sources of truth is a very helpful thing too.
Well, thank you for enlightening everyone.
And
we'll
good luck
try and do better.
finishing your schooling.
Thank you.
And thank you for being such a huge integral part in our community.
I love this community. I love what you guys are doing. I sincerely appreciate your help.
That's
So
up our
thank you.
game on the tatas. Thank you.
Thank you.
Coming up next on Studio Chatter, we'll learn more about screening for breast cancer. Stay with us.